Hi everyone, Dr. Tran here. Today I am going to talk to you guys about dental implants. So what are dental implants? Basically, dental implants are a replacement, a man-made version of a replacement for your natural teeth. There's three parts to an implant that we talk about, and I'm going to bring up a little model here to help show us what a dental implant is. So this model here, if we look right here, you can see there is an implant in the clear tissue here, which is technically your bone. That gets placed to replace the root part of the tooth. The part that goes on top of that is called an abutment. So this little stub sticking out there is what we would call an abutment. That gets screwed into the implant fixture. There's many different types of abutments that we would use depending on what we're putting on top of the implant. So in this case, this is an implant bridge where there's three missing teeth. There's two implants that are placed, one here and here. There's two abutments on each of the implants to connect to the bridge here. So in that way, we're able to replace three missing teeth in a row. So that is one example. But if you just look at one side of this, a single tooth replacement for an implant would be the fixture that's in that goes in the bone there, the abutment that goes on top, and then the crown that sits on top of that, so that you are able to chew like you did when you had a tooth there. So that's the most clear-cut example that I can give you for what an implant is. There's a lot of different things that we can do with dental implants nowadays, especially if you're missing more than just a single tooth. But again, we can replace teeth from a single tooth all the way up until the full arch, and there's a few different ways that we can do that. This is a model showing an implant bridge. So in this case, the person would be missing all of their teeth and all of the teeth on the top arch, for example, or the top jaw. And in this model, it's showing 4 technical implants in the jaw. So that this is just a kind of a generic model showing where the implants would be, and then where the connections would be if we were doing a full arch implant bridge. So you can kind of see where they are screwed in. This is a type of appliance that doesn't come out of the mouth. It stays fixed. It stays screwed into the mouth. So the only person that can really remove it is your dentist or another dentist. But again, first the implants will be placed, and then the restoration or the bridge is what would be connected on top of that. So this is a fixed solution to replace missing teeth, and in this case, it's replacing all of the teeth on one of the arches or one of the jaws. Another example of something that we can do with implants, let's say the bridge isn't for you, which in most cases, if this was an option, we would probably go for something like this. But maybe you already have an existing denture, and that denture is not fitting as well as it used to, or maybe you just need a little bit more attachment to help hold that denture in. So this is something this is a model that shows an implant over denture. So for example, now in this model, they have the roof of the mouth, they have it hollowed out in a U shape. But for the sake of just showing you how this connects to the implants, we put special abutments or connectors on top of those implants. And there's a partner that actually snaps into those attachments. So this is an example of what we call a locator attachment. Those locators, when we place the denture on top of those implants, those attachments, we literally, you can hear it kind of snap or click in, and this helps to not only retain the denture but semi-support the denture. Dentures in general are also tissue bound or tissue supported, so you're kind of relying on both factors with that. Alrighty, so those are 2 examples, or I guess that's 3 examples of how we can replace teeth with implants. But there's a lot of different variations depending on your certain situation that we can use to help you replace your teeth naturally, but with fixed options with titanium implants. Thanks for listening.